Type of me, type of me, type of me. If you are excited, type of me. So I'm going to go all the way back. So just a very quick recap of what we covered yesterday, day one, and then we're going to jump into today's session, day two. So let me make this a bit bigger. I'm going to take myself off. Great. So I'm seeing some of your answers. Let's go, Marvin. I've got framework. Fantastic. So this is what we did yesterday. For anyone that missed the session yesterday, we went through this very quickly. We focused on, we spoke about the introduced myself. Then we had the most important part was the 5 keys to pass your GPhC exam. We also did 1 or 2 recall questions at the end. I introduced myself, and then we had these 5 keys. These are the most important keys. Key number 1 is understanding your GPhC framework. Day 1 was all about understanding the framework and understanding how GPhC questions are set and those that set the questions. Then day 2, the second thing we had, the second key was learn how to apply. So the key word was apply your knowledge in a timely manner. So it's not just applying, but also being aware of time. So we started that yesterday, which was showing you how to apply this. But today, we're going to look at 2 and 3. So today, we will do a lot in terms of applying the strategies and showing you how to answer recall versus analysis type questions, which most students struggle with. And most of your examples, the questions will either be a recall question or it's going to be an analysis prioritization style question, which requires critical thinking. So be happy today, be relaxed. You will learn some amazing strategies and you'll be able to smash any question. So we looked at the GPhC framework. We spoke about this, how to apply is important, timely, professional judgments. These are the things that the GPhC is looking at. Your number sense. So calculations we mentioned was so important. And we're going to have a calculation session coming up very soon. We spoke about practicing safely, and we're going to do all these questions today. We looked at the 2 types of papers, part 1, part 2, and then we focus on your SBA questions, which are your single best answered questions. We said you're going to get 90 of these questions in your exam in paper 2, and you're going to get 30 extended matching questions. So these are very important. We spoke about the structure, how the GPhC structures this exam. I highlighted why the GPhC questions are different from these mocks that you do. So don't lose your confidence if you're not doing well in mocks. They're not really a true reflection of the GPhC exam itself. We spoke about the process. The GPhC goes through a process, which is a multi-stage review process. The questions are less ambiguous. The questions are clearer. The questions are more concise, and there is a structure to all of them, which will make things a lot clearer and easier for you in the actual exam compared to random mock questions. So we went through all of this. We spoke about the exam, how it's written. We spoke about those that write the exam. I did mention that think about you're going into war. And when you're going to war, you need to know your enemy. Right, so we're talking about those that set the exam, what they're looking at, what they're testing you on. Having that knowledge empowers you to go into that exam and totally smash the exam. We spoke about how questions are set, the key requirements that have to be in questions. We spoke about even distractors. And I said to you, all of these things today that we spoke about, we will do them today. Today is all about practice. It's about showing you in action. We're going to do the things in action. We're going to do GPhC questions, and then we're going to apply the strategies to help you. So we stopped on key number 2, which is learning how to apply your knowledge. So today's about applying your knowledge and strategies, and tomorrow will be the same as well. I said to you guys, I'm going to pace you. We're going to do questions. We're going to do some easy questions, and we're going to build it up. So I'm not going to come in and just give you all tough questions. I'm going to give you what the GPhC does. You will have a mixture of some recall questions that are quite easy. You will have a few medium style questions in terms of difficulty. And then you have a few challenging questions. So what we're going to do throughout this 7 days is we're going to give you the reality. But the good thing about it, which you should be excited about, is I'm going to show you strategies to answer any type of question. So whether it's an easy recall question, or whether it's a medium sort of strength question, or whether it's a very challenging question. So guys, you are in the right place at the right time. It's going to be fun tonight. So the keys, and then we spoke about, in order for you to pass the exam, you need to understand the difference between recall versus analysis style questions. So the next part of the training is to show you which questions are recall questions so that you could identify them, and then also show you which ones are analysis questions. And then we're going to show you how to strategies to answer all of those questions. So we went to the first question, which was question number 1. We reminded you of the structure of GPhC questions, where you have a scenario, where you have your question, which is normally in bold, and then you have 5 options. So this question was easy for most of you because this is a recall question. So with these sort of questions, these are the questions that students tend to do well in, because all you have to do is memorize and reproduce. So if you're a student that's good at recall, you're able to memorize the entire BNF, you're able to memorize everything around you, you have absolutely no problems when it comes to recall questions. But having that memory will not be the same for analysis type questions. So that's the reason why many of you learn a topic, you've gone through the cardiovascular system, you remember your stuff, but when it comes to doing certain questions, you struggle. Because these questions require critical thinking, and no one has really taught you critical thinking. So today's a good day for you. It's going to change everything for you. Everything. I'm excited for all of you. And then we give an example. So, and you guys did these questions within sort of seconds, and you will get a number of questions in your exam that will be this short. These are recall questions, this easy, this direct. So we even spoke about distractors. So I'll show an example of a distractor. So if you did this question yesterday, a distractor in this question, which the GPhC does, is 28 days, right? So you could have 28 days. The correct answer is 30 days, but it's very easy for anyone to go 28 days, because most of us think, okay, it's a month, right? It's valid for a month, but a month in this sense for your controlled drugs is 30 days. It's not 28 days. So this is put in there, which is plausible, because in practice, that's fine. You could think 28 days, but in the actual exam itself, there is only one correct answer. So today you're going to see the difference, where we're going to have analysis type questions, and the difference between analysis type questions, there are more than one plausible answer. Hence the reason why most of you with this sort of questions, you get to a point where you can eliminate A, B, C, but then you are stuck on what to choose between D and E, and then you end up getting the question wrong. So this is what we did yesterday, and then we ended up with a question. We did end up with one question, which I gave you, and I said to you, this question is an example of an analysis type question. So it wasn't like these ones, it was just an analysis, an example of an analysis type question, which is what we're going to focus on today. 313 of us in here. Wow, let's do this, ladies and gents. Great to have all of you. Thank you for giving me the privilege to teach you. I am excited. I want to help you, and I will help you. So this is where we stopped yesterday, and then we had a question. We ended with a question with no answer. Let me see if I could show you what that question was. Where was that? Let me stop sharing this. Let me share the new screen. What was the question? So this is today, and this is the question. Okay, this is the question that we stopped on yesterday. Do you guys remember this question? Give me a yes, give me a yes, give me a yes, give me a yes. Tosif is in the house. Tosif says, true, struggling with these type questions. I know this, Tosif. That's why I'm here. That's why I'm here. No one really teaches you these, because it's very hard to teach you how to think critically. But I found out an easy way to teach you. Wait, see, these scripts are valid for 28 days, right? So we had this question yesterday. Everyone gave the answer. What was the answer? It was 30 days. Shalom, Muyambo. I'm happy you mentioned this, because this is what I'm saying. This is a distractor. Right? On a day-to-day basis, that might sound correct. But Shalom Muyambo, if you were in the GPhC exam and this question came up, you will get this question wrong. Right? Because it's 30 days. Okay, it's 30 days. So this is what this session is all about. Okay, so let's go into the question. Can you guys see the question? I'm not put the question up, actually. Let me take this comment out and let me put the question up. Please let me know if you can see the question. Let me make sure you can see the question. Let me share this question, present the question, share the screen. I'll tell you when the question is up. This is the question. Can you all see the question now? Give me yes, give me yes, give me yes. Give me yes, give me yes, give me yes. Great stuff. We can all see the questions. Give me a yes. Give me a yes if you can. Can you see the question? Is the question up? Please let me know before we start. Simon, with yesterday's pain, don't worry about yesterday. We will do questions today. Okay, yesterday was not about looking at those questions with the answers. It was about you understanding the structure and knowing the different style of questions. But believe me, today and tomorrow, it's all about questions. Okay, we're going to go through them. So this specific question is an example. It's an example of an analysis type question. So if you look at this question very carefully, make that a bit bigger. If you look at this question very carefully, you will see it's a bit different from the recall question that we looked at a few minutes ago. Right? So I'm not going to give you guys the answer now. What I'm going to do is I'm going to show you and teach you all the strategies. We're going to answer a few questions, and then at the end, we're going to answer this question, applying the strategies that you've just learned. So sit back, relax. Are you guys ready? Make sure you have a glass next to you, some water, have a hot drink, have something next to you, because this is going to be an amazing session. Are we ready? Give me some energy. Give me some energy. I'm just going to drop a track for you guys for 10 seconds just to put you in the mood, because this is when things start changing. This is when you become an expert and you're going to notice a change in your thinking. 5 seconds. Let's go. Great stuff. Let's get on, people, ladies and gents. It's all about the energy. I want to feel your energy. I want you to interact. Boom. Let's go. Boom. So let's look at all of your different type of questions with strategies. This is going to change everything for you. I'm so excited. I'm so excited. I'm so excited. So let me take this out. Let me bring my right slides on here. So the slide that I want is the slide for today, which is this one. So let me move into this. Can you guys see the slide? Has that changed? Can you see the agenda for today? Give me a 1 if you can. Is it on agenda? Give me a 1. Let's get it, Temi. Let's get it. You need to have energy. Imagine me coming up here trying to motivate you. Guys, I'm so excited today. Oh my gosh, I'm so motivated. You will all be so motivated. You're going to be like, get out of here. We don't do that. That's not me, guys. That's not me. I bring the energy, I bring the knowledge, I bring the fun, and I bring the success. So here's today's agenda. I can see all of you are saying this day number 2, recall versus analysis, GPhC questions. And then it's understanding critical thinking. I'm going to show you how to think critically. I'm going to teach you some privatization strategies. And these are strategies that are going to help you to answer these questions that you struggle with in the GPhC exam. And we're going to do a lot of this stuff, So let's get in. So the next slide I got for you. Make sure you guys can see the slides. I don't want anyone to miss anything today. So next slide. So we're going to look at an example. This is an example of a recall question, right? So we're going through different phases. The first recall questions that I showed you were very direct. I told you it's going to get a bit harder, but then you have the strategies. So the first thing we're going to do, we're going to answer this question together, and I'm going to answer this question showing you strategies that you use to answer these type of questions. So this question is a recall question. And in the next coming slides, I'm going to show you, because the first thing you want to do is be able, as I mentioned, to differentiate between a recall question and an analysis type question. There are certain keywords that you will see that will give you a hint that it's an analysis type questions, such as the most appropriate, the most likely, the most suitable. Analysis questions will have comorbidities in them. There'll be different conditions. There will be the patient description of the patient. As a child, is a woman, she's breastfeeding. There'll be some sort of drug history, right? So I'm going to show you guys all these examples. But today, this is a question. This is a recall question. So I'm going to show you guys how to answer this type of questions, and I'm going to make it so easy for you. We use a process with this type of questions. You use a process called the elimination strategy, okay? We're going to use a strategy called elimination strategy for recall questions. I showed this on my private sessions to many trainees, and there are many trainees that get questions correct in the exam, even without knowing the topic, simply by applying elimination strategy. Okay, so the first strategy we're going to use for this recall question is elimination. So what am I going to do with elimination strategy? You're not looking for the correct answer. With the elimination strategy, we are looking for the wrong answers. We are eliminating the wrong answers. This, to me, is one of the most effective strategies that you can use for these questions. And when we come to the analysis questions, you even say it's even more effective. So what we're going to do, the reason we know why this is a recall question, you're going to see later. But recall questions are questions where you don't need a lot of analysis. You need memory. You know the stuff, right? So this is what we're going to do. Elimination strategy. So let's see how we're going to do this question. Remember I said to you, time is important. So whatever technique, the reason why I'm trying to teach you strategies as well is because I'm trying to show you by using a strategy, what happens is you save yourself time. Just like I do a lot of mnemonics. Strategies save you time. And we showed you that yesterday, the GPhC is not only testing your knowledge, but it's also testing your speed. So this is how we do this question using the elimination strategy. The first thing we want to do is we want to eliminate all the wrong answers first. We're not bothered about the right answer at this stage. So what you want to do, let's look at this question. So this question, responsible pharmacist, town pharmacy, has organized. Sometimes what you may do, and you may see people do, this really works. You start with the bold first. You just read the question first, then you go into a scenario. It's a very good method to just know what the question is going to ask you for. So everything you need, as we mentioned yesterday, when we looked at the structure of a question, we said everything you need is going to be in the question, in the scenario. So for this one, we will start by eliminating the wrong answers. So if we look at this question, we're trying to find out which option in the table represents the activities which may lawfully occur in town pharmacy during the pharmacist's temporary absence of less than 2 hours. So it's not just about getting the answer right. It's about getting the answer right in a very short time. Does that make sense? Give me a one, give me a one, give me one. Strategies is not just about getting the answer right. There are many students that fail the exam not because they don't know the answer, but simply because they ran out of time. Reason why I'm showing you strategies is also to help you with your speed. Okay, so you guys look at how I'm going to apply this strategy now and see how quick this strategy is going to help you answer this question. This is a GPhC question. So this is what we're going to do. So sale of the GSL, right? Sale of a GSL medicine without a pharmacist. Can you do this? Yes or no? Can you sell a GSL if the pharmacist is not in the pharmacy for less than 2 hours? Can you or can't you? So this is why this is a recall question, because this is some knowledge, right? It's from memory. So the answer is yes, you can. Okay, you can sell GSL if the pharmacy isn't in your pharmacy, if your pharmacist is not there for 2 hours. So what we're going to do is any answer that says no, you can't, we're going to eliminate that answer. That's what we do. And once you practice this, you'll be so quick and you'll be so good at this. So first thing we're going to do is we're going to take this because this says no, we can't sell GSL, and that's so we know that's totally wrong. We'll eliminate the answer. We'll look at the next question. Next line says clinical check of a batch of repeat prescriptions from the local GP. Can you clinically check a prescription without a pharmacist in there? Can you, yes or no? Guys, this is when you think about, you can't do that, right? So this is based on you cannot clinically check when the pharmacist. So any answer that says yes, you can, we're going to eliminate it. With the elimination strategy, we're not looking for the correct answer. We're just taking out the wrong answers. This says yes, you can, that cannot be correct. This says yes, you can, that cannot be correct. So we'll look at the next one, emergency supply. So now we know we're left with two options. It can either be this or this. And we're very confident about this. So emergency supply of a pump at the request of a patient. Can you give an emergency supply to a patient when the pharmacist isn't there? You cannot do that. So an answer that says yes, you can, we need to eliminate the answer. So all of a sudden, within a few seconds, and once you guys practice the strategies, I promise you're going to walk into the exam. You're going to do it so quick. So within a few seconds, we know the answer. The correct answer is this one. And that's even without trying to read all the answers and trying to pull out, trying to read all the options and trying to pull out which one is the right one. All we've done is we've taken out all the wrong ones and then boom, we're left with the right one. So this is what we call elimination strategy. The correct answer is the third one. Okay, that is your right answer. It's this option. So again, as I said to you, it's not really, I'm not here to really test you on the question and the answer. I'm here to teach you strategies. Is this strategy clear? Give me one, give me one. Did you guys see how quick this strategy is? We're going to use this with more questions and you'll see exactly how it works. So within a few seconds, you are able to answer questions by applying the right strategies in the GPhC exam. Great stuff. So I've got one. 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 Great stuff. So let's move on to our next question. So you're going to see that the difficulties of the questions are going to increase slowly. Okay, so I'm giving you from easy and then we're getting them a bit harder. But at the same time, I'm giving you strategies so that even the harder ones will be easier for you. Are we ready for the next question? Give me a two, give me a two, give me a two. If you're ready for the next question, remember this is a recall question. Recall questions tend to be easier. And I'll teach you more strategies. So by using elimination processes, they're going to help you with the recall questions. So someone says, can you be a bit quicker? Someone says, can you be a bit quicker? You're repeating the same sentence. Bear in mind, we had an exam. I have no time wasting. Shazadi, no. Because you may want it quicker, but I wouldn't do it quicker. Reason, because not everyone is at the same level. Right? So I'm going to take my time and I'm going to make sure everybody understands before I move on to the next section. That's what I always do, and that's what I will always do. Okay, so next question, guys. Next question, without rushing anything. Without rushing anything, it's all about understanding. It's all about understanding. Next one, question number 2. This is another recall question. So I'll give you guys a few seconds. Look at this question. The strategy we're going to use is called a common side effect strategy. So you will see, and I'm going to show you guys this. This is a recall question. So with the recall questions, you don't really need to stress too much about them. They don't really need too much thinking. All right, so you need to identify, and in the next slides, I'm going to show you your analysis type questions. So with this recall question, what's the answer, guys? What's the answer? Ran says, take your time. Don't worry. Don't worry about Iran. I will always take my time. I'm here for everyone, and I'm going to make sure every single person understands before we move on to the next thing. Okay, so your pace is fine, right? It is perfect. I know it is. It is. It's all about understanding. So I'm getting your answers. Dipyridamole, fantastic. I'm getting dipyridamole, fantastic, fantastic, fantastic. Okay, so let's look at the strategy we applied for this. And I'm going to show you the strategy. Some of you might know this. And again, recall questions are easier questions. But by using what we call a common side effect strategy, we've looked at the first one, which is your elimination strategy. With this, you're going to have questions in your exam where what you really want to do when they give you these questions, you want to look for a common side effect. And this is when you have a number of drugs. So you have questions like this where you're going to have a number of drugs. This question could be in between a recall and analysis question, but it's more recall. So the question, which of this should be stopped due to the commencement of rivaroxaban? All you're looking for is rivaroxaban causes bleeding. So you're looking for a drug with a common side effect, another drug that causes bleeding. And you guys are going to see this when we look at analysis questions. This is where, when we look at extended matching questions, that's why I'm really taking my time. Some of you will see that some things are more complicated, right? So that's why you have to remember the strategy. You are looking for any drug that has the same side effect as this drug. So the only one there that has the same side effect is dipyridamole. Antiplatelets could cause bleeding. So this is the one we are going to stop. So most of this is probably recall as opposed to analysis. We've not really analyzed the question deeply. We just know is dipyridamole cause bleeding and bleeding. Is this clear? Give me one, and we're going to move on to the next question. So common side effects. Common side effects. And you see that another question. So we're answering GPhC questions. Don't be stressed. They are not that bad if you use the right strategies. So let's go to the next question. If you're ready for the next question, type of 3, type of 3, type of 3, common side effects, guys. And you will see that when we come to extended matching question, you will see us apply this formula, and it's going to make a lot more sense to you. Okay. So next question. Right. So now this is the real thing. This is where people struggle. Right. So analysis, critical thinking questions. We've done our recall questions. We've shown an example of recall questions, and most of you are fine with recall questions because you just memorize stuff. Now, this is the area where so many students struggle. This is the area that can cause you to fail the exam. This is the area that if you look at the GPh's feedback after every single exam, they always mention that the area where students fail the most are these type of questions. And again, I just spoke to a professor that told me the same thing, right? So this is the first time you're probably having a critical thinking session. And there are a few key things you have to look out for. So priority, keywords. The way you know an analysis type question, these questions are going to have keywords like most likely, right? Most likely, most suitable, most appropriate. This is how you start to know you're dealing with an analysis, a critical thinking question. The reason why this question traps a lot of people is because they're asking for the most, which means that there may be plausible, there may be correct answers, other answers that are plausible in the sense that in practice, they could be okay. But in the exam, there's only one correct answer. And this is that's why I need to show you guys the difference. Another thing you need to watch out for with your priority questions is this one: correct versus plausible answers. I'm going to give you guys a question in a second that's going to show you correct versus plausible answers. The reason why this is so important is that the GPhC actually states, and I showed you guys how questions are written, they actually put plausible answers, which means that there may be answers, there will be a number of answers that are correct, in the sense that they're correct in the sense that they are common. So you may see a common side effect. A drug could cause one side effect and also cause another, but you have both in the same question. But they're looking for a correct one, which I'm going to show you guys how to distinguish between a plausible answer and the actual correct answer. Then these questions have comorbidities. Yesterday, we looked at the GPhC framework, and it stated very clearly that they will give you quite a number of questions. Most of the scenarios you're going to have are patients with comorbidities. So they have more than one condition. So your analysis questions tend to have more than one condition. So the patient's got hypertension, has got diabetes as well, maybe suffered from heart failure, or has got gout. These questions normally have a list of drugs in them, right? So you see, they'll talk about the patient's PMR, patient's records, or the patient's drug chart, but they will give you probably more questions. That's how you identify you're dealing with an analysis type question. There's going to be a list of issues, and there's going to be a list of presenting symptoms. Now, this is the reason why you guys struggle, because as you can see, there are quite a number of things in the question that you need to know. But here's the good news for you. I'm going to give you a strategy that will put all of these things together in a very simple way. These questions also have sometimes diagnostic tests or test results in them. That's how you know you're dealing with an analysis question. So the GPhC questions may not necessarily have all of these. So you wouldn't get a question that's everything, diagnostic tests, pictures, keywords, but they'll have some of these in there. May have allergies in there, something's about an allergy. They're going to have keywords, which I'm going to show you guys the keyword strategy. You have abstracts, so sometimes it could be an abstract, it could be some sort of SPC, it could be an abstract from the BNF, it could be something for you to refer to, or there could be a picture. Another thing is the subjects are important. You will see that some questions will be women, pregnant women, it could be a child, it could be an elderly, so the subject is important. They will have distractors, things to distract you, and then we've got other. Other is perhaps they could put anything else that is not on the list. Okay, but what I want you guys to remember is this is the reason why many of us struggle with these questions, because they have many different things that you need to know to answer these questions. So are we ready for an analysis question? And I'm going to show you the strategies so that they become so easy for you. Give me a one. Someone says, how do you know the difference? This is exactly what we're going to do. Okay, this is exactly what we're going to do. So let's get straight in, guys. Let's get straight in. So are we ready? Give me one. Give me one. Let's look at an analysis question. The questions are getting slightly harder, but we are using the same correct principles to answer them. So let me go onto my slide. 1 second. Just 1 second. That stopped sharing for some reason. Okay. Sorry about that. Okay, so is that sharing again? Give me a 2. Give me a 2. That's sharing. Make sure that we're back on there. All right, so let's look at a critical thinking question. Okay, and I'm going to give you guys a formula. So this question, can you guys try this question? So this is an example of some questions will be a mixture of recall and analysis, right? So you might have some questions, they're not fully recall questions and they're not fully analysis questions, sort of in between. And these questions are also a bit easier to answer. So if you look at this question, again, it has certain characteristics of questions that are recall questions. One of the things to say about recall questions is the scenario tends to be short, right? So this is a short scenario. We said with analysis questions, they have most appropriate, because that means that there could be more than one plausible answer in the options. So this has most appropriate, which makes it sort of an analysis type question. At the same time, that's very short, so it could be a recall question. And so you have to answer it. So what this means is, you probably know this from memory, but at the same time, it means that there could be more than one option that has this information, right? So there could be more than one option here that you could actually get some of this information from. But there's only one correct answer that is the best option. So what answer did you guys go for this? So which reference, if you're looking for the vaccine stocks in the pharmacy, which reference would you go for? So I'm getting lots of C's. Fantastic. So lots of C's. So the answers actually C, immunization, but this is the green book. But can you get some information from the BNF, yes or no? Can you get some information about vaccines, maybe some monetary requirements? Let me know, guys, yes or no. Can you? If you open your BNF and you went into a section with vaccines, can you get some information about vaccines? Give me a yes or a no. Let me know. Give me a yes. Let me see your comments. Let's see your comments. Fantastic. I've got yes. I've got yes. I've got yes. Great stuff. So what does this mean? This is why people get this wrong, and we're going to see later on, is because the question, when the GPS is testing you, this could be, you could get information. So this is a plausible option. It could be a distractor. It's plausible, but there's only one answer, the best answer. They're always asking for the best answer, right? So we're going to continue, and I'm going to show you how to choose the best answer. So these are the easier ones, and then we're going to move into the next question. So now we're going to go into the questions that are a bit harder, that require thinking. But for me to do that with you, I've got to give you the strategy. So this is the strategy, guys. You want to type this down in the comments, please. This is what's going to change your life. This is how you'll be able to answer any question. We've looked at different strategies, elimination strategies. We've looked at the side effects, common side effect strategy. Now let's look at the strategy, which is probably the most important, is GPS disco. Guys, type in disco in the comment. Type in disco. If you're ready for the disco, type in disco. So everything that I showed you in the previous slide, all of this stuff, I showed you guys quite a lot of things that you need to look at when you're analyzing these questions. You have to know all of this stuff. This GPS strategy literally puts all of these things together for you. So I've taken all of these things to make it easy, and all you have to do is learn GPS disco. So we're going to talk about using the GPS disco strategy. We normally start with disco and then GPS. So this is a very, very powerful tool for you to use. And I'm going to show you how to apply this. So the first thing we're going to look at is all these questions, analysis questions. You have to highlight, look at the drugs. The drugs will give you some information. The GP is going to put some drugs, watch out. Some drugs might tell you the patient is diabetic. They could tell you the patient is hypertensive. That is important information. The questions are going to have an issue. So what is the main issue? What is this patient coming in for? What are the presenting symptoms? Look at the subject, right? There's going to be a subject. Is it male? Is it female? Is it an elderly patient? Is it a child? All of this will require different approaches. Then you've got condition. What condition does this patient have? As I mentioned, you're going to have comorbidities. So you need to use this, and I'm going to show you how to do that. And then we have other, and other is different information in the question. So it could either be allergies, or it could be something on blood results, or it could be any of those other things which we showed you could be other, right? So they might put other information that you may need. Now, once you've gone through this, you would then have to use, finally, GPS. And GPS simply means many of the questions, you have to know your guidelines. So it'll be either a question where you need to know your hypertension guideline, or you might need to know your heart failure guideline, or it could be some sort of asthma guideline. But generally, to find out the correct answer, you have to refer to the guideline. Then you've got priority. You need to know what's the priority. The question that people struggle more is, what's the priority? Will you refer this patient to the doctor? Will you treat them in the pharmacy? What is the priority? right? So you need to understand priorities in order to choose the right answer. And then the last part, which is S, is the most important, is safety. Go for the safe option. And then this part is what students don't know about, but this is what we're going to focus on as well. The option that you have to choose has to be within your scope of practice. Because in these questions, if you listen to what the GPhC says, in your exam, they want you to think as pharmacists. You're meant to answer the question as a pharmacist, not a pharmacy trainee, as a pharmacist. And one of the ways that you determine the right option is you have to ask yourself, is this option within my scope of practice? Which simply means, as a pharmacist, can I do this action? Can I do this? Can I give this medication? Can I sell this medication? Is there something I can do at my level to solve this problem? If it's not within your scope of practice, then that's a referral question. That's a referral. So you guys are going to see that later on. These questions that ask you, should you refer to GP? Should you treat them? I'm going to show you, you need to know the scope, right? So we're going to apply the strategies. So it's quite deep stuff, guys, but it's amazing. So are we ready? Give me one. Give me one. We're going to use GPS discos. We're going to show you how you can use this with any clinical question and how you're going to literally smash all those complicated, complex GPhC analysis type questions. Great. Let's do this, guys. Let's do this. So first thing we're going to look at, mention to you guys, correct versus plausible scenarios. Try this question. So in this question, we're going to use analysis and prioritization strategy, and we're going to use GPS disco. So look at that question and give me your answers, and then I'm going to show you how to use the right strategy to get the correct answer. I'll give you guys probably a few seconds. It's fine. When you have your answer, please put your answer in the comments. 330 of us. Wow. Lots of us on here. Great stuff. So just look at this question, because this is a GPhC question or type question. It's an analysis type question. So it's not as easy as some of the other ones. But I just want you guys to look at this, and then I'll show you how to answer this type of questions. So those of you also on the combo course will go through this. So let's look at how we apply this strategy. So by applying DISCO, remember DISCO and then GPS, start off with DISCO. You have to ask yourself, with all these questions, you're going to have a scenario like I showed you yesterday. You're going to have a question. You're going to have 5 options in alphabetical order. So the first thing we want to ask ourselves is D, which is drugs. Are there any drugs involved in the question? And what does that tell you? So there's always information. So are there drugs? Yes. What are the drugs we can see? This patient's on metformin. This patient's on glycoside. This patient's on simvastatin. What does this tell us? There is a condition in there. We're looking at diabetes. So this is the information the drugs are going to give you. Any issue? Can you guys say any issue? What is the issue with the patient? This patient has recently been diagnosed with hypertension. There is hypertension there. If you do it this way, I promise you, you're going to smash all these questions. So there's an issue, and you highlight that is hypertension. So the next thing is your S. So if we look at this, we have the hypertension, but let's look at the subject. Who are we looking at? It's so important. And if you don't do this part, you may get this question wrong. So our subject is an African Caribbean male. This is key. So I'm showing you keywords. With this strategy, you'll be able to identify your keywords and questions. So that's an African Caribbean male, 32 years old. That gives you a lot of information to answer the question. We look for a condition. Is there any condition, any other condition? We know this patient is suffering from hypertension. We cannot see any other condition, so that's okay. So you may not have all of these things with DISCO, but you will probably have some in there to use. Is there any blood results, any other thing you can use? No, that's fine. So what medication below is the most suitable step to manage his hypertension? This is also a prioritization question. We need to know our guidelines. So we're going to GPS, which means G is for guidelines. You need to know your guidelines. So what drug do we use for diabetes? Right? If patients got diabetes, hypertension, what do we use? Now, if you do not highlight it's an African Caribbean with diabetes, if you do not do this part, you might look at it and think African Caribbean, and you go straight away. It's a calcium channel blocker to manage hypertension, and so the answer is A. That's why you have to follow the strategy. So we have to look at what the guideline says. That's your G. And according to your guideline, anyone that has got diabetes, you have to start off with an ACE inhibitor for renal protection. It could be an ACE or an ARB. So in this case, this could be correct and this could be correct. But according to the guidelines, if you have a Black African, the preferred drug to give them is an ARB over an ACE inhibitor. So this ACE inhibitor is literally a distractor. Most of your distractors are plausible because in practice, it is not wrong. So you may see in your pharmacy, there may be some Black Africans that are diabetic on Ramipril. Nothing wrong with that. It's not like a safety, like, oh my gosh, they're going to die or something. Because that's actually the guideline. But in terms of preference, and this is where we come into priority, in terms of priority, that's why you have your P. What is the best, the most suitable? You're going to go for the most suitable. This isn't wrong, but the most suitable is D. Right? So the answer, we don't have to do the scope here. And safety, losartan, probably less coughing with that, but we don't really need scope for this question. So disco, GPS, and we come to this answer, and that's how we answer these questions. Is that clear? Give me one, give me one, give me one. So we have to apply this strategy. Give me one if that's clear. We're going to go to the next question, and you guys will see how to apply this even better. Great. So if you see on the A's could be correct in an exam, people might struggle. They might go for A's, and then it's like, oh my gosh, it's D. All right, it's an ARB because of our guidelines. So next question, are you ready for the next question? Give me 3. Type a 3 in the comments, ladies and gents. If you're ready for the next question, type of comments. We're going to make them harder as they go up, but then we're going to use our strategy. So here's our next question. We always get this type of questions in the exam. This is an analysis type question. This is a question where we could use elimination strategy. So I'll show you guys elimination strategy. If you get any of these questions about referring to GPs and things like this, you want to use GPS disco, but also most importantly, you want to use an elimination strategy. All right. So we're going to do this so that you guys can see. So if you have your answer, what's your answer? Put your answer down. What does disco stand for again? So someone has missed it. So what does disco stand for again? Make sure you go back. Make sure you go back. This is what it stands for. I'll just show you. I know someone asked. This is disco, drugs, issues, subject, condition, other, and then GPS. Guys, this is a lifesaver. This is a lifesaver. It will help you to analyze questions critically. So let's do this together. And I'll show you guys how to apply the same strategies to another analysis type question. So now we know what analysis type questions look at. We know what they look like. The longer, they have more information. They have a subject. They have issues. So these are comorbidities and things like this. They have the word most appropriate, least likely. So if we look at this question, we can honestly say using our formula that this is definitely an analysis type question. So what will be the answer? This is what we have to do. This patient, mother brings in a 6-year-old son to your pharmacy. I told you with this type of questions, you're going to have the subject. So we're going to look at disco. Let's use disco. Any drugs? Does this child take any drugs? So it's a 6-year-old. So any drugs? Can we see any drugs in there? The child has no medical condition. So there's nothing to worry about drugs. And when you see this in the exam, start smiling. Because that means they're not trying to trap you on drugs and side effects and things like this. The child takes no drugs, no medical condition. That's good. What is the issue? Do we have an issue? Yes, we have. So what is the issue? What is this child presenting with? So it's right. So what is this patient presenting with? We can see in the past 2 days, we can see there is a cold. Symptoms have worsened, so the cold has gotten worse. But now the child complains of mild headaches, general aches, and tiredness. So we have some issues. This morning, the child has developed an itchy rash on the face and body. So we have a headache, mild headache. We've got general aches. We've got tiredness. We also have an itchy rash on the face and the body. So this could be anything. At this stage, this could be anything. Okay, this is how you look at the questions. So you move on to the next thing, the subject. Who are we looking at? Is it a male? Is it a female? It's a child. So that already starts to go, oh, red flags, a child. What do we do? Do we refer them? These rashes look wild. The child, it's been 2 days. They've had the symptoms for 2 days. A child with symptoms like this for 2 days. Aches all over, right? Mild headache, tiredness, itching all over the face. So we've looked at the subject, the condition, there's no other condition. We have to determine what condition this is. We could think perhaps it's chickenpox or something, but we don't know yet, right? We don't know what this is exactly. We also look at other, is there any other thing, maybe some blood results or anything in the question? No, there isn't. So we're ready to jump straight in. Guys, I'm taking my time to explain to you this, and this may look like it takes time at the beginning, but I promise you, once you practice this, it will be so easy. I can do this within 2 seconds. Because once you use the strategy a few times, you do some questions, you're going to notice your speed is just going to be so quick. Like literally, you don't even need to go into the order of DISO. I just go, okay, this is an issue, straight away a drug, boom, that's the scope, and then you have your answer. So let's look at this. So let's look at options. So we're going to use DISCO because we need to know our guidelines. We've looked at this, but also going to use the elimination strategy. So elimination strategy, remember guys, we're just going for wrong answers. You don't have to worry here about the right answer. You don't even know what that's chickenpox. You don't know what it is. All you know is let's try to get the wrong answers out. So provide general advice about the condition and recommend the use of hydrocortisone cream. We're going to take that out straight away because we know you cannot use hydrocortisone cream on a child, okay? The less than 10 years old, forget about it. All right, so you cannot use this, let alone on the face. So we're going to take that out because it's just not correct. Provide general advice about the condition and recommend the use of ibuprofen for the headache and general aches. Interesting. Could we do this? But we're going to cross that off because we know as well we cannot use ibuprofen on a rash on kids because ibuprofen only makes your rash worse. Okay, so this is part of your guidelines. Ibuprofen makes your skin more sensitive and it makes any rash worse, especially on a child. So we've not determined what kind of rash this is. We're not really interested in that at this stage. We're just in the process of eliminating things that we know are wrong to make our life easy. So we're going to take that off. C, provide general advice about the condition and recommend the use of paracetamol for the headache and general aches as necessary. So I'll leave a question mark because this sounds okay. And the reason why this sounds okay is because paracetamol is safe. So we've got safety. It's within our scope of practice. As a pharmacist, you can give the child paracetamol. It's within your scope, right? So the GPhC is going to test you on your safety and what's within your scope of practice. So the next one, D, provide general advice about the condition without recommending any medicines. So providing general advice is good. Perhaps you might say to yourself, I don't want to recommend anything because I don't know what this is. It's a child and the child has been sick for the past 2 days, complaints of headaches, general aches, tiredness. I will refer this patient. So you may go, I'm going to go for E, refer the child to the GP. I don't know what this is. It's been a few days. This child is in pain. Refer the child to the GP. So what we're going to look at is this. D, we're going to cross D out. We're not going to do D simply because we're not giving them any medicine. And if you're not giving them any medication, you're not doing what is within your scope of practice because you can give this child something for the pain. Okay? And I cannot see any sort of red flags on there. So the next thing is E, which this is sort of plausible. So in practice, if you refer this child to the GP, you won't be wrong. Right? You wouldn't be wrong. No one's going to come to you. You might say, I've analyzed the situation. I've looked at this child, and based on this, I think it's a child. I'd rather refer them as opposed to give them anything. But within your scope of practice, which is what they're going to be testing you on, the most appropriate answer will be something that you can do within your scope of practice. So looking at this, we can tell straight away that these look like symptoms of chickenpox. These look like symptoms of chickenpox, and with the mild headache, you can give the child paracetamol. It's a mild headache, right? The past 2 days, general aches and tiredness. These are signs of chickenpox. So because of this, we will give the child this. The correct answer will be C, because you're going to give them general advice. You're going to recommend the use of paracetamol, and this option follows this. It ticks all the boxes because it is safe. Paracetamol is safe. it is within your scope of practice. If you went for E, you get the question wrong. And what happens in many questions why students struggle, what the GPhC says is many students don't know how to choose what to do. They refer people to the doctors when it's a question where you have to treat in the pharmacy and vice versa. So is this clear? Give me one, give me one, give me one. So this is how you use this. All right, this is how you use this. Look at, is it within your scope of practice? Look at the safety of your recommendation. Look at the condition. Look at the person. Look at all of this. In the exam, will they describe the rash in more detail? They don't need to. They could, but they don't need to. You have enough information to take action. And that's what I said to you guys before, right? The GPhC, most of your questions are things based on practice. Like if this happened on a day-to-day basis and someone came to pharmacy, mother brought the child in, and the child had this, and that's why I said to you, the rash could be anything. But then what is within your scope of practice is at least you can help to deal with this pain, right? So if you give them the paracetamol and the headaches, there are no other red flags. Past 2 days, there are signs that look like it's chicken pox. That should be the decision. And then when you look at the answers as well in the question, the answers will give you hints. So if you see B, for instance, talks about ibuprofen, you know the GPhC is trying to test you about ibuprofen. You don't give ibuprofen to a chickenpox rash. So this is how you determine this is the right answer. But the reason why I'm trying to highlight this for you is because some people will get confused and some of you in the exam will go for E. But always remember, is it within your scope of practice? And is there something that you can do as a pharmacist to help that child? If the answer is yes, that is the option. That is the option. Okay, so great stuff. Let's go on to the next question. Next question. Are we ready for next question? So this is the next question. Look at the question, and then we're going to apply our strategy to answer this one. So Zaid was asking, how do you know if you have enough to give paracetamol and not to refer this patient? Sorry, guys, for 1 second, let me go back because I want to answer your questions. And this is where your critical thinking comes in. Okay, sorry, I'll just go back one because someone's asked a question, which I really want to answer this question, right? Because it's an important question. It's an important question, right? So how do you know if you have enough info to give paracetamol and not refer this patient? How do you know that? So this is how you know. Look at the question and let's think critically. Okay, look at the question again. How do you know this? Look at this question. Why would you refer the patient? Are there any red flags? What is a red flag to refer this child to the GP? So this child has just been 2 days and the symptoms are getting worse. This is perfectly normal. It is not a dying situation. The headache is mild. General aches and tiredness. So these are common symptoms that you will get with chickenpox anyway. They're not referral symptoms. If this child, it was a very, very severe headache, maybe sensitive to light, and so there are going to be some things in those questions where you're going to go, okay, maybe they've been feeling down, they've not eaten, they're dehydrated, it's been going on for more than a week, and things like this. But all of the symptoms show that it's mild. This morning has developed an itchy rash on the face, so this rash only started today. The child has no other medical condition. The child has no allergies. All of this tell you it is not really an emergency. If you send this child to the doctor is going to be very disappointed with you. Because they're going to ask, why are you sending this child to me when all of these things? So this is how you make that decision to give paracetamol, because you're going to deal with the pain. And if you deal with the pain and there's a chickenpox rash, it's going to disappear. And if it does and things get worse, then that child could end up being referred to the GP. Okay, so some of you have given me answers for this question. Another GPhC question there. Great, great. Is that clear? Whoever asked that question, I hope that's clear. Okay, if there was something like meningitis, exactly. So, and you would know. Remember I said to you guys this, that's why you don't have to worry. The GPhC exam is not like your mock questions. They will be clear and they will be concise. If it is really something that you need to refer to the GP, there will be some things in there that are sort of red flags. Okay, they will give you a hint. If there are no red flags, then it's definitely something that they want to make sure that you try to at least treat that patient in the pharmacy. Okay, so I'm getting loads of A's. I'm getting loads of A's, loads of A's. Fantastic. Marvin, I love you. I love you too. So great stuff. I love the love. Fantastic. Samir says, use the word severe. Thank you, Samir. So I'm happy that you guys are all thinking. Is this making sense, by the way? Give me a one, give me a one. So that's what I'm trying to help you to think about questions. There are keywords to look out for. GPhC exam is going to have those keywords, and we're going to go through this stuff. Okay, but I'm going to take my time because I want you guys to understand. We may go slightly above 9, but which we are, but that's okay. Okay, if you need to leave, that's fine. But I really think this is going to make a difference for so many of you. Okay, fantastic. So many of you have gone for I'm not the pin. So I'm not the pin. I'm not the pin. I'm not the pin. So why did we go for I'm not the pin? I will agree with you. I will agree. I'm not the pin. And again, if we used our GPS disco, we will still come to the same answer. Okay, because according to your guidelines, again, it's an analysis question because there's an age, it's a man, Black, African, they've given you more details. But this analysis is a little bit still like a recall question because the scenario is not that long. This most appropriate with us an analysis question, and then it's referring to your guidelines, which is GPS. So all of you that went for I'm not the pin, that is correct. So this is a GPhC question, and you will get many questions in your exam that are this direct, guys. Please don't stress. Please don't stress. It's not as bad as you think it's going to be. And by the end of the 7 days, you're going to be fine. Okay, so let's go to the next one. So the question, answer definitely is I'm not the pin because Black African. So it's calcium channel blocker first. There is no, this sort of questions will be the best for you, right? When you look at these questions and there is no other medical condition and there is no allergies, you're laughing, right? The worst question they could give you is what I showed you guys here, is a question that has got all of these things in there, which they will never do. Right? And even if they did, guess what? You're still going to get it correct. But this is like putting everything, allergies, everything, list of drugs, everything. But most of the time, they put probably one or two of those things. That's why it's so important that you guys learn this because it's just going to make you so good. Right? So let's go. Next question. Next question, guys. Let's try this question. Someone's asking how much harder are the mocks than the actual exam. I went through this yesterday in day one. Cash, please look at what I said about in day one. The GPhC exam the mocks tend to be harder, but not just harder, really. It's not just harder, but they're inconsistent. They're not properly reviewed like the GPhC does. They're not as clear, they're not as concise. So they're not a true reflection of the questions you're going to get in your exam. So, but mocks are good to help you for revision. So I normally say to people with your mocks, if you're scoring anything above 65%, based on what mock you do. So an example, some students talk about the Bradford mock being so difficult and buttercups. So perhaps with those mocks, if you're getting anything 65%, you'll be okay. Plus, with other mocks that may be easier, 70%. But the main thing is you want to be getting around that range between 65 to 70% consistently for at least about 10 mocks, okay? But then please don't place all your emphasis on that. It's not a true reflection of the actual exam itself. Many people, including myself, I failed so many mocks and I still went out to pass the exam. I found the questions clearer. There was no ambiguity and it was the right sort of questions asking for my daily practice. Okay, so great stuff. I've got different answers, but loads of E's coming up. Naproxen. Fantastic. I know that GPhC question on there. And yes, it is naproxen. It is naproxen simply because, remember, we're going to use elimination strategy. And if we look at all of these drugs, the one that affects the kidneys, because the abnormality is with your serum creatinine, estimated GFR. So that's why I said to you guys yesterday, you don't really need to be an expert in biochemistry and all of this. The questions will be more direct. So you don't need to know the details about NSAIDs and how they affect the kidneys and all your prostaglandins and all of that. It's enough to just know that NSAIDs, right? All your NSAIDs affect your kidneys, right? So they may be dangerous for anyone that's got any renal impairment. So because of that, because serum creatinine is out of range and GFR, it shows that whichever drug you're looking at is one that affects your kidneys, which that's going to be your NSAID. Okay, so we could still use the same process. We went through the drugs. This is other, right? Just an example. They're going to give you test results. This falls on the other. We can still tick off it's a man. We could over there. We could see that. We could see the whole scenario. We could see drugs involved. Amlodipine, lisinopril. So most of these drugs that we have in here, we don't really need them to answer this question. So this question is sort of in between a recall question and an analysis type question. Okay, is this clear? Give me a 2, give me a 2, and I'll move to the next question. And then we could probably stop there because I know you guys got to do something else. And then tomorrow we'll continue the questions. So I'll do more questions. Tomorrow the questions will be even harder than these ones. So we're going to step it up a level. These ones are mostly GPhC questions, but I'll give you even harder ones so that you could see how you could apply the strategy even more. So fantastic. Some of you have mnemonics. Very good. Okay, so this is also you showing part of your recall and using analysis. Are you guys enjoying the session so far? We'll continue questions. Give me 1, give me 1, give me 1. If you're learning, you're understanding, give me 1. Questions will get more difficult, but at the same time, it will be easy because you have these strategies. All right. So let's just go to the next one. Let's go to the next one. And then we may stop there and continue tomorrow. So this is the next question. I think someone was asking this earlier. Someone might have seen this yesterday. I went, oh, what was the answer for this question? So I'll give you guys a few seconds. Take your time. It's fine. I'm not timing you on your speed or anything here. The main thing is to teach you a strategy. So try to answer this question and then let me know your answers. I'm loving the love, guys. Thank you for the love. I love you too. I love you too. Thanks. I really appreciate. I appreciate all of you guys. All of you that are on here, I really appreciate you. And I'll do everything to make sure you pass the exam. Everything to make sure I boost your confidence in the coming days. The exam is not that bad. More students pass this exam than fail the exam, and you will pass too. All right. So I know some of you have put D. Some of you have gone for paracetamol. Some of you have gone for ibuprofen. So let's look at this, and I'll give you guys the answer. But again, another important question, this from the GPhC, we're going to use the elimination process. So if we use our GPS disco, we're going to look for drugs. Are there any drugs in the questions? Give me a yes if there are any drugs that this patient is taking. Not in the answers, any drugs. I'm going to look at my D and go, okay, lower back pain, 2 days. She thinks she's hurt her back. Okay, no red flags. Thank you for mentioning that. Right? So when you see the GPhC putting no red flag, that's trying to tell you, don't really think too much about this question. No red flags require any referral, no allergies. Thank you very much for letting me know that. So does not take any regular medications. Fantastic. That's what we want to hear. So the question is not really an interaction type question. So no medicine. So D, they've done our job for us. We don't have any D there. Thank you very much. So the next thing we're going to look at is the issue. What's the issue? It's a lower back pain. All right, so we're looking at lower back pain. It started 2 days ago. The very fact that this patient, she thinks she's hurt her back, she's literally coming to the pharmacy, that's a good sign. Okay, that means it's not that bad. It's not that bad if they could physically come into the pharmacy. Started 2 days ago. She thinks, and also look at the language, she thinks that she's hurt her back. When someone says the think, then it's not that bad, right? So the language is important. She thinks that she has hurt her back whilst gardening. No red flags. Nothing, no allergies. She takes no medication. She's not pregnant. She's not breastfeeding. It's a simple scenario for us. So the issue is back pain. The subject, we'll look at the lady and we're happy to know that she's not pregnant or breastfeeding. So we don't need to focus about interactions and things like that. And you get this in the GPhC exam. Condition, there's no other condition apart from the back pain she's got. Other, there's nothing other there for us to use. We're going to look at our GPS now. We've looked at disco. We're happy. GPS, what does the guideline say? So the reason why you have most appropriate is because you can have more than one plausible answer in this question. But we need to look for the most appropriate. And the only way you know the most appropriate, you need GPS. So think about GPS as your navigation. And GPS is what's going to help you to know between A and B. So when you get to the stage where you can eliminate certain things and you stop between two answers, GPS is what gets you to know the right answer to choose. So in this case, I'll definitely take away acupuncture because it's just not appropriate to tell them acupuncture. Right? So we'll take that off. Then we have cocodamol. Question mark. Because this could be plausible. Right? This could be plausible. This could be plausible. We've got ibuprofen. This could be plausible. Paracetamol, this could be plausible. Tens, nah, we'll take that out. We're left with three things. Now, the only way I said to you guys, the only way is to think about two things. Your GPS. What does your guideline say about lower back pain? What is the priority of all these medications? And what is safe, right, within your scope of practice? So in this case, what does the guideline say? The guideline actually says for back pain, and if you think about back pain, there might be some inflammation, ibuprofen is preferred. It doesn't mean that paracetamol wouldn't help, or in practice, if you gave paracetamol, it's not wrong. I've seen this happen. People come to pharmacy, oh, my back is hurting, and someone says, I'll give you paracetamol because I'm going up the pain ladder. So according to the pain ladder, we're going to obviously go paracetamol first, it's the safest, boom, right? And if you did that in practice, it's fine. But according to your guidelines, for lower back pain, paracetamol is just not strong enough. So the recommendation is ibuprofen. So the correct answer is this. But you could, the second choice is if the patient, okay, let me ask you guys a question. If, for example, this patient was asthmatic, what would be the option? And that's what tomorrow will be about. I know some of you might have seen this GPhC question, so maybe you might be answering from seeing the answers already. But let's add something to this. If that question said the patient was asthmatic, what answer would you go for? Someone said, what if the back pain started today? It doesn't make any difference. It doesn't make any difference if it started today. So, right, so I've asked this question. Okay, do you guys see what's happening now? This is very interesting. So what I've done is I've put one thing that GPhC could do. We'll say this patient's asthmatic, and I'm having different answers. So some of you are going to go for paracetamol, and some of you are going to go for codeine. All right? Okay. Right, so which one are we going to go for? Which one are we going to go for? Are we going to go for paracetamol because this is coming in your exam, or are we going to go for codeine? Let's apply our GPS. That's the only way we could do this. So if we look at that and we assume that this patient has got asthma, simply means we have to take away ibuprofen. So we're left now with two choices. We're either left with cocodamol or we are left with paracetamol. So how do we choose which is which? We need to know our guidelines, right? Our GPS. And if we don't know the GPS, I'm going to show you something else. So according to our guidelines, and some of you said this before, you're not going to give paracetamol because paracetamol is too weak. It's too weak to treat the lower back pain. It's not strong enough. It is safe, but it's not strong enough. In this case, and if you look at your BNF, it says it's ibuprofen, but the second line is normally an opioid. So it could be a weak opioid, like tramadol, or it could be cocodamol. Right? It could be codeine, if we've got codeine, better, or it could be cocodamol. Right? So the second option, if this patient was asthmatic, the answer you want to go for, the answer will be this one. Simply because, as we know, according to your guidelines, paracetamol is just simply too weak for lower back pain. So in practice, if you had this patient and you gave them paracetamol, you are literally compromising their safety in a way, because you're giving them something that is not even going to help with the pain. Okay, so you're being safe, you're giving them that, but that's not going to do anything. So the option then will be your cocodamol. Okay, is that clear? But so we'll have to use GPS to answer these questions. Paracetamol alone is not effective. Absolutely. Right? It's not effective. If asthma is well controlled, then cocodamol, yes. So cocodamol. How bad is the pain? Someone's asking, and these are things that you have to look. That's why you analyze questions. How bad is this pain, people? When you look at this pain, what would you guys say? On a scale of 0 to 10, where would you put this pain? Just looking at the question, because that will determine how you react. Just look at this question. Where would you say this pain is? And people say asking questions, respiratory depression, it wouldn't cause respiratory depression. It's very low. It's going to be just for a few days anyway. Most of the time, even when you sell cocodamol, it's 500, which is your OTC. How many days do you normally sell them for? Right? This is not a POM medication. That sense, right? This is an OTC. You're looking at 3 days. So you don't have to go into all the detail about the side effects of your opioids and respiratory depression. No, no, no. Okay. She's able to walk. So the pain is not, there's no red flags. They've told you all of this in the question. That's why I showed you guys using that framework will help you. These are things that will tell you what you're looking at. The patient, no red flags, no allergies, no regular medication, not pregnant, has come into the pharmacy. All of that should tell you this patient lower back pain. But lower back pain, regardless of whether it's a level 0 or it's a level 1 or level 10, lower back pain in general, paracetamol isn't strong enough. Right? So we're going to go cocodamol as our best option. This will just be a distractor. Is this clear, ladies and gents? I think we're going to stop there for you. Tomorrow, we're going to continue more questions. The questions are going to get even more difficult. We'll do some of these GPhC questions, and then we'll have more difficult questions so that we can apply more strategies on there. Okay? There's a question there. But she hasn't tried paracetamol yet. Thought you said we use the guidelines. Fantastic. Good question. So Sisa Senkosi said she hasn't tried paracetamol yet. But that's what I'm saying. According to your guidelines, if you look into your BNF, the guideline actually says go straight and give them ibuprofen. Okay? The guideline actually says to you paracetamol is not strong enough for lower back pain. Regardless. So in this case, you're not going through, I want to give a paracetamol first, I want to do this. You're going for the guideline. And your guideline says NSAID first. And if an NSAID isn't working, look for a weak opioid. Right? So it eliminates paracetamol. So choosing paracetamol will not be going according to your GPS. Someone has put this on here. Samir, thank you. Guideline, do not offer paracetamol alone for migraine. Fantastic. Thank you very much. Great stuff, people. Great stuff. So have a lovely evening. We will continue tomorrow. Day number 3. Don't miss day number 3. More questions, harder questions. We're going to use more of the strategies so you apply, so you practice. And then what you're going to notice is that once you understand the strategies and you start to use them from today, you're going to get so used to them, will be so quick. And when you actually meet those GPhC questions, they will actually be a lot easier for you because you're able to think critically. Thank you, ladies and gentlemen. Have a lovely evening, and I look forward to seeing you all soon.